Here's a shocking truth. Most people believe every medical appointment begins with a careful evaluation of their health. But their concerns are interrupted after only a few sentences. New symptoms are quickly explained away as part of getting older. Treatment options seem surprisingly limited, and difficult questions are met with brief, reassuring answers instead of deeper investigation. Could these experiences simply be the result of busy clinics? Sometimes, yes. But after speaking with former healthcare workers, patient advocates, caregivers, and many older adults themselves, one thing became increasingly clear. Age can quietly influence the way some medical decisions are made, often without anyone realizing it. That doesn't mean doctors don't care. Most dedicate their lives to helping others. Yet, like anyone working under pressure, they can be influenced by assumptions, habits, and unconscious biases. And when those assumptions affect an older patient, the consequences can be serious. Important symptoms may receive less attention. Diagnoses may come later than they should. Opportunities for early treatment can be missed. In some cases, those delays can change the course of a person's health, and even shorten the years they could have enjoyed with family. In today's video, we're going to uncover 5 uncomfortable truths that every older adult should understand before their next medical appointment. More importantly, you'll learn practical ways to make sure your concerns are heard, your questions are answered, and your healthcare decisions are based on your individual needs, not simply the number on your birth certificate. Be sure to stay until the very end, because the 5th truth is the one that surprises people the most. Once you understand it, you may never walk into a doctor's office the same way again. Before we begin, please take a moment to like this video and subscribe to the channel if you enjoy thoughtful content designed to help older adults live healthier, wiser, and more confident lives. Let us know in the comments. How old are you, and where are you watching from? We always enjoy seeing people from different ages and places come together in this wonderful community. Let's begin with the first truth. Doctors see seniors as complicated and expensive. In some cases, the moment your age appears on the medical chart, an impression has already begun to form. Older adults are often viewed as patients with more complicated medical histories, a longer list of medications, more chronic conditions, a greater chance that one symptom may be connected to several different health issues. From a clinical standpoint, these are realities that physicians frequently encounter. But when those expectations become automatic assumptions, they can unintentionally change the way a consultation unfolds. Instead of seeing the individual sitting in front of them, some healthcare providers may first see what they expect the visit to become. A longer conversation, multiple concerns that cannot all be addressed in one appointment, difficult medication decisions, and additional paperwork. Without realizing it, they may begin looking for the quickest path through the consultation instead of the most complete one. Imagine Margaret, a 72-year-old retired elementary school teacher who scheduled an appointment after noticing several unusual changes over the previous month. She had begun feeling unusually short of breath while walking her dog, experienced occasional pressure across her upper chest, and found herself becoming exhausted by activities that had always felt easy. Wanting to make the most of her visit, she carefully wrote every symptom in a small notebook before arriving. As soon as the appointment began, she opened the notebook and quietly said, "I'd like to explain a few things I've noticed." Before she could finish describing the second symptom, the physician gently interrupted. "Let's focus on the biggest problem today." Margaret nodded politely. She chose to mention the fatigue because it bothered her most often. The shortness of breath seemed less urgent, and the chest discomfort only happened occasionally. The visit ended with routine blood work and advice to rest more, stay hydrated, and come back if things became worse. Several months later, after her symptoms gradually intensified, further testing revealed that the underlying problem had been developing all along. Earlier evaluation might not have changed everything, but it almost certainly would have allowed treatment to begin sooner. Stories like Margaret's don't happen simply because doctors don't care. More often, they happen because busy clinics encourage efficiency. Physicians may have only 15 or 20 minutes to evaluate patients whose medical histories could easily require an hour. Faced with those pressures, conversations are naturally shortened. Questions become more focused, and subtle clues can be overlooked. The challenge is that older adults rarely fit neatly into a single symptom or a single diagnosis. Fatigue may be related to the heart, the lungs, medication side effects, thyroid disease, anemia, or something entirely different. When the conversation is cut short too quickly, the larger picture can remain hidden. Fortunately, there are practical ways to help shift the conversation in your favor. Before every appointment, spend a few minutes identifying the 2 or 3 concerns that matter most, instead of trying to remember everything in the moment. Write down when each symptom began, how often it occurs, and whether it has been getting better or worse. Clear, organized information helps your doctor recognize patterns much more quickly. If you know your concerns are complex, don't hesitate to ask whether a longer follow-up appointment would be appropriate. Many patients assume they have to fit everything into one visit, but requesting additional time is often a reasonable way to ensure important issues receive proper attention. During the appointment, take notes or bring a trusted family member to help remember key details. This not only helps you recall the discussion later, but also signals that you're actively engaged in your own care. Most importantly, approach the conversation as a partner rather than a passive patient. Instead of simply saying, "I don't feel well," try explaining what has changed in your daily life. Perhaps you've stopped taking your usual morning walks. Maybe climbing the stairs has become noticeably harder over the past 6 weeks. Specific examples paint a much clearer picture than general descriptions. When doctors see an organized, prepared patient who communicates clearly, the entire dynamic of the appointment often changes. The discussion becomes more focused, more collaborative, and more likely to uncover the answers you're looking for. Unfortunately, even when an older adult explains their symptoms clearly and comes prepared with detailed information, there's another obstacle that can quietly stand in the way of receiving the right care. Number 2. Doctors blame everything on aging. Aging certainly brings natural changes. We may not move as quickly as we once did. Recovery can take longer. Our eyesight, hearing, and energy often change over time. Those are normal parts of life. But normal aging should never become the automatic explanation for every new symptom. The danger begins when age becomes the first diagnosis, instead of the last possibility to consider. Imagine Robert, a 69-year-old retired electrician who had always enjoyed working in his garden. One spring, he noticed that his hands felt unusually stiff every morning. At first, he assumed he had simply overworked them, but as the weeks passed, the stiffness lasted longer. His fingers became swollen, opening jars became difficult, and even buttoning his shirt required more effort than before. When he mentioned these changes during a routine appointment, the response was reassuring. "Your joints have carried you for nearly 70 years, the doctor said with a smile. "Some stiffness is completely normal." Robert accepted the explanation. After all, he trusted his physician. Over the following months, however, the pain spread to his wrists and shoulders. Activities he had always enjoyed slowly disappeared from his daily routine. Eventually, after seeking a second opinion, extensive testing revealed that he had rheumatoid arthritis, an autoimmune disease that had been actively damaging his joints the entire time. By then, some of that damage could no longer be reversed. The unfortunate reality is that many serious medical conditions begin with symptoms that seem surprisingly ordinary. Persistent fatigue may be dismissed as simply slowing down. Unexplained weight loss might be attributed to a smaller appetite with age. Shortness of breath may be blamed on getting older, instead of prompting a closer look at the heart or lungs. Even changes in mood can be misunderstood. An older adult who suddenly loses interest in favorite hobbies, withdraws from family, or struggles to sleep may hear, "It's understandable at your age." Sometimes it is understandable. But sometimes it's depression, a medical condition that deserves the same attention and treatment as diabetes or high blood pressure. The same pattern can occur with thyroid disorders, certain cancers, heart disease, vitamin deficiencies, or medication side effects. None of these conditions announce themselves with a flashing warning sign. They often begin quietly, hiding behind symptoms that can easily resemble ordinary aging. That is exactly why asking questions matters. One of the most helpful habits you can develop is describing change, not simply describing discomfort. Instead of saying, "I've been feeling tired," try saying, "Until 2 months ago, I walked 2 miles every morning without difficulty. Now I need to stop and rest after only a few blocks." That single comparison gives your doctor valuable clinical information. It establishes a clear baseline and shows that something has changed rather than simply existing as part of your normal aging process. If you're told that a symptom is likely age-related, don't be afraid to continue the conversation respectfully. You might ask, "Can you help me understand what makes you confident this is normal aging rather than another medical condition?" Or, "Are there any tests that could help rule out more serious causes before we assume it's age?" These aren't confrontational questions, they're thoughtful ones. Good physicians generally appreciate patients who want to understand the reasoning behind a medical decision. If testing isn't recommended, ask why. Understanding why a particular test is, or isn't, necessary helps you become an informed partner in your care, instead of leaving with unanswered doubts. It can also be helpful to keep a simple symptom journal. Write down when the problem first appeared, how frequently it occurs, what makes it worse, and whether it's gradually changing. Patterns that seem insignificant over a single day often become much more meaningful when viewed over several weeks. Remember this simple principle: growing older is normal. Sudden changes are not always normal. Your age may influence your health, but it should never prevent a careful search for the real cause. Number 3. Doctors assume. Seniors can't understand. Some healthcare professionals quietly assume that older patients will struggle to understand complicated medical information. Of course, cognitive changes can affect some people as they age. But age alone does not tell anyone how clearly you think, how well you understand, or how capable you are of making decisions about your own health. A retired accountant, teacher, engineer, business owner, or parent may have spent decades solving difficult problems, managing responsibilities, and making choices under pressure. Yet inside a medical office, that same person may suddenly be treated as though complex information is beyond them. This assumption can shape the entire conversation. Explanations become brief and simplified. Risks and benefits are summarized in only a few sentences. Newer treatments may never be mentioned because they require more discussion, closer monitoring, or the use of unfamiliar technology. Sometimes a family member is addressed instead of the patient, even when the patient is fully capable of speaking and deciding for themselves. Consider the experience of Eleanor, a 73-year-old retired laboratory instructor who was diagnosed with an early-stage breast tumor. During her first consultation, the surgeon recommended the most straightforward operation and presented it as the obvious choice. The explanation was calm and reassuring, but very little was said about other possibilities. Eleanor asked whether there were less invasive approaches, additional testing that could guide treatment, or therapies that might reduce the extent of surgery. The doctor replied that those options could become complicated and that, at her age, it might be better to keep the plan simple. But Eleanor had spent much of her career teaching students how to understand chemical reactions, laboratory safety, and scientific evidence. What troubled her was that the decision seemed to be based more on an assumption about her age than on a careful discussion of her health, priorities, and ability to manage treatment. She requested another consultation. This time, the specialist explained several options, including additional imaging, tumor analysis, different surgical approaches, and follow-up treatments. After reviewing the information, Eleanor chose a plan that was slightly more involved, but better matched her personal goals. The important point is not that one treatment is always better than another. It is that Eleanor deserved to hear the full range of reasonable choices before making her decision. When older adults are given only simplified recommendations, they may lose access to treatments that could offer better results. They may also miss opportunities to use patient portals, home monitoring devices, telehealth appointments, or digital medication systems because someone assumes they will not be comfortable with technology. Over time, this can affect confidence as much as care. If people repeatedly speak to you as though you cannot understand, you may begin to question yourself. You may stop asking questions, accept the first recommendation, or rely on others to make decisions you are still fully capable of making. That loss of confidence can become a self-fulfilling cycle. The less information you receive, the harder it becomes to participate. The less you participate, the more others assume you are unable to do so. The best way to interrupt that pattern is to make your expectations clear from the beginning. A simple statement can change the tone of the conversation. I would like to understand all of my options, including the more complex ones, before I decide. You can also ask for detailed explanations rather than summaries. Try saying, "Please explain how each treatment works, what the main risks are, and why you recommend one over the others." Before an appointment, read reliable information about your condition and prepare a few specific questions. Bringing notes shows that you are engaged and helps you remember important details. If a medical term is unfamiliar, ask for clarification, but do not allow that moment to be mistaken for an inability to understand the larger issue. You should also ask whether newer treatments, technologies, or clinical approaches are available. If one is not suitable for you, request the medical reason. The answer should be based on your health, not simply your age. And whenever possible, ask for written information about every reasonable option. This gives you time to review the details, discuss them with someone you trust, and make a decision without feeling rushed. Now, the fourth truth is even more uncomfortable because it involves something many of us rarely question. A prescription. Most medications prescribed to older adults are appropriate and genuinely improve health. They relieve pain, control chronic diseases, prevent complications, and help millions of people live longer, healthier lives. But there are also situations where a medication is prescribed less to treat a disease and more to manage a person's behavior. This doesn't happen in every clinic or every hospital, but it does happen often enough that older adults and their families should understand the warning signs. When an older patient becomes anxious during a hospital stay, asks repeated questions, struggles to sleep in an unfamiliar environment, or becomes frustrated during recovery, the easiest solution is not always the best one. Instead of asking why that person feels distressed, the focus may quickly shift toward making them calmer and quieter. In these situations, medications such as sedatives, anti-anxiety drugs, sleeping pills, or even certain antidepressants may be introduced before the underlying cause has been fully explored. Consider the experience of Dorothy, a 74-year-old retired librarian who underwent knee replacement surgery. She was determined to recover as quickly as possible. Every day, she asked detailed questions about her rehabilitation. She wanted to know how much she should walk, when the pain would improve, and what exercises would help her return home sooner. Some members of the medical team interpreted her constant questions as excessive worry. To help her relax, an anti-anxiety medication was added to her treatment plan. At first, Dorothy felt calmer, but within days, she also became unusually sleepy. During physical therapy, she struggled to stay focused. She occasionally forgot instructions she had just been given. One evening, she stood up too quickly to walk to the bathroom, became dizzy, lost her balance, and fell. Fortunately, she did not suffer another major injury, but the fall delayed her rehabilitation by several weeks and greatly reduced her confidence. Her greatest obstacle was no longer the knee surgery itself. It was the side effects of a medication that had never been intended to heal her knee in the first place. This illustrates why medications deserve regular review, especially later in life. As we age, our bodies process drugs differently. A dose that causes little difficulty for a younger adult may lead to confusion, drowsiness, or poor balance in someone 20 or 30 years older. Sedatives can increase the risk of falls. Sleeping pills may leave a person groggy well into the following morning. Some anti-anxiety medications can affect concentration and memory. Even certain antidepressants, while very beneficial for people who truly need them, may produce unwanted side effects if prescribed without a clear medical reason. Perhaps the most concerning consequence is that medication side effects sometimes resemble entirely new illnesses. A person who becomes forgetful after starting a new prescription may appear to be developing dementia. Someone who seems unusually withdrawn may actually be experiencing medication-related fatigue rather than worsening depression. Another older adult who suddenly becomes unsteady on their feet may be suffering from dizziness caused by medication instead of natural aging. Without recognizing the real cause, more medications can be added, making the situation even more complicated. This is why every prescription should begin with a conversation, not just an instruction. Whenever your doctor recommends a new medication, don't hesitate to ask 4 simple questions. First, what specific medical condition is this medication treating? Second, how will we know if it is actually working? What improvement should I expect? Third, how long am I expected to take it? Is this temporary or long-term? And finally, are there other treatment options that should be considered before adding another medication? These questions are not a sign of distrust. They are the questions of an informed patient who wants to participate in decisions about their own health. A good physician will usually welcome that conversation because the goal should never be to prescribe more medication than necessary. The goal is to prescribe the right medication, for the right reason, for the right amount of time. The first 4 truths we've discussed all point to one important reality. Assumptions can influence healthcare in ways that neither patients nor providers always recognize. But the 5th truth is perhaps the most difficult to accept. Doctors quietly calculate your life's value. No ethical physician would ever say that one life is worth more than another. Every patient deserves dignity, respect, and compassionate care. Yet modern healthcare also operates within the realities of limited resources, financial pressures, insurance policies, and clinical guidelines. In that environment, age can sometimes become one of the factors considered when recommending certain treatments. The concern is not simply chronological age itself. Doctors must always weigh the potential benefits and risks of any procedure. An aggressive treatment that helps one patient may cause more harm than good for another. The problem arises when age becomes the deciding factor before the individual's overall health, independence, and personal goals have been fully considered. Many older adults remain physically active, mentally sharp, and capable of enjoying many meaningful years ahead. Yet they may occasionally hear phrases such as, "Let's not be too aggressive," or "At this stage of life, comfort may be the better option." Before every reasonable alternative has been carefully discussed, consider the story of Harold, a 70-year-old retired architect who developed advanced kidney disease. Aside from his kidney condition, he remained remarkably active. He walked every morning, volunteered at a local community center, and rarely missed his grandchildren's weekend soccer games. When his kidney function declined, one physician suggested that dialysis might not be worthwhile given his age. The conversation focused mainly on the burdens of treatment rather than the possibility of maintaining an active life. Harold wasn't convinced. He sought another opinion from a nephrologist who specialized in caring for older adults. After a thorough evaluation, the specialist concluded that Harold was an excellent candidate for dialysis because his overall health was otherwise strong. The treatment was certainly challenging, but it allowed him to continue living independently. He celebrated family birthdays, traveled with his wife, watched another grandchild graduate from college, and remained active in his community for 7 more fulfilling years. Those were not simply 7 additional years. They were 7 years filled with purpose, relationships, and memories that might never have happened if the first recommendation had been accepted without question. Stories like Harold's remind us that chronological age tells only a small part of the story. Two people may both be 75 years old while having completely different levels of strength, mobility, memory, and resilience. One number cannot accurately predict how much someone may benefit from treatment, yet age-related assumptions can influence many different areas of healthcare. Sometimes additional imaging or specialized diagnostic tests are postponed because symptoms are assumed to be part of aging. Certain surgeries may be dismissed before a full evaluation of a patient's physical fitness has been completed. Older adults with cancer may not always hear about every available treatment option because others assume they would not tolerate intensive therapy. Mental health concerns can also receive less attention, with sadness, anxiety, or withdrawal mistakenly viewed as unavoidable parts of growing older rather than conditions that deserve proper care. Even in emergency departments, where decisions often need to be made quickly, unconscious assumptions about age may influence how aggressively symptoms are investigated. Fortunately, there are practical ways to protect yourself. If a recommended treatment seems more limited than you expected, respectfully ask a simple but powerful question. If I were 20 years younger but otherwise had the same overall health, would you recommend a different treatment? That question does not challenge your doctor's integrity. Instead, it encourages a conversation about whether the recommendation is based on your medical condition or simply your age. If you still feel uncertain, seek a second opinion. Many patients worry that doing so will offend their physician, but responsible doctors generally understand that major medical decisions deserve careful consideration. Whenever possible, consult specialists who regularly care for older adults. Geriatricians and physicians with extensive experience treating seniors often evaluate health based on function, independence, and quality of life rather than age alone. If you believe you are being denied appropriate care because of age, don't hesitate to involve a trusted family member or patient advocate. Many hospitals also have patient relations departments that can help ensure your concerns are heard and your questions are fully addressed. Most importantly, remember this: your birth date is only one piece of your medical story. It should never become the entire story. Growing older should never mean accepting lower expectations for your healthcare. The 5 truths we've shared today aren't meant to make you fear doctors, but to help you become a more informed and confident patient. Ask questions, speak up when something doesn't feel right, and remember that your age should never determine the quality of care you receive. If you found this video helpful, please like, subscribe, and share it with someone who may benefit from hearing these messages. And before you leave, tell us in the comments, have you ever felt that your age affected the way you were treated by a healthcare professional? We'd love to hear your story. Thank you for watching, and we'll see you in the next video.